Hello, good afternoon. My name is Jorge Terrazas. I'm going to be the nurse practitioner examining you today. We're going to be examining your stomach. Would that be okay?
Yeah.
Yes? Okay, perfect. So what I'm going to do is I'm going to go ahead and give you a little cover. We're going to go ahead and put it on your underside. And then I'm going to lift your shirt up right above to your chest line, okay? So if I could, I'm going to ask you, go ahead and lay with your head down over here. Perfect. If you could scoot down for me, please. Perfect. Okay, so what we're going to do is we're going to go ahead and expose the patient now. We're going to lift his shirt right underneath the nipple line. And then we're also going to give the patient a little cover so that we could expose his pubis area. Okay, are you comfortable? So prior to examination, I'm going to inspect the abdomen. I'm going to be making sure that there's no protrusions, there's no color discoloration. I'm going to be making sure that it is nice and symmetrical. Be checking for hair growth at the same time as well. To get a good view of the patient's abdomen, we could either start at the foot of the bed, and then we could look, make sure that everything is symmetrical, that we don't have no protrusions. Another good way to inspect the abdomen prior to everything would be also to look at it from the side and just make sure that the contour of the stomach is nice and even and that we don't have no bulges. Sometimes we could check for hernias, and the way we would do that is I would ask the patient to go ahead and take a nice deep breath and go ahead and bear down for me to check for any hernias, because sometimes that's how hernias best present themselves. So what you're going to do is you're going to take in a nice deep breath, and I want you to push down like if you were going to go number 2, okay? Okay, so take a deep breath for me. Push down like you're going to, there you go. And at this point, I'm inspecting the abdomen, making sure that it doesn't have no protrusions, and I'm looking for any hernias. Okay. After I inspect, I will go ahead and auscultate the patient's abdomen. We're going to inspect the patient's abdomen so that way we could listen for bowel sounds. So I'm going to go ahead and start in the gastric region, which is right in the center of the stomach. So I'm going to be placing the stethoscope on your stomach, and I'm going to be listening, okay? So I'm going to go ahead and place my belt in the gastric area. And I'm going to be listening for any bruits. I don't hear any bruits. So I'm going to go ahead and go over. I'm going to begin listening to bowel sounds. So I do hear bowel sounds. They're nice and normal, active. I also have bowel sounds in the left lower quadrant. I'm going to move over right under the belly button. I do hear bowel sounds as well. And I hear bowel sounds. And I hear bowel sounds. While I'm also listening to the patient and I'm checking, I already checked in the gastric area to hear for any bruits for the aorta. Right above the umbilicus, that's where we have the bifurcation. And I don't hear any bruits. I will also check for the femoral aortas while I am auscultating the patient's abdomen. So I don't hear no bruits either. So patient sounds are present. Patient's bowel sounds are present in all quadrants and they're normal active. Now that I have gone ahead and I've actually listened to the patient's bowel sounds, I'm now going to go ahead and I'm going to start doing percussion in order to find the patient's liver and spleen. So we're going to start on the patient's right midclavicular line, right above the costal line, and I'm going to give it a nice tap. Right there where you hear the dullness, that's actually where your liver is. So right now, I got the patient's liver right here. And you do hear that change in sound. You hear from the dullness to the hyperresonant. So I'm measuring about maybe 3 centimeters of the patient's liver. Now if we go over to the patient's left side, we could actually start percussing as well, so that we could check for the spleen. So we have that hyperresonance, and there we have that dullness. So what we could also do is we could do a little bit of percussion. That way we could feel that little that air bubble that's behind the triad space right here on the left side on the coastal area. While we're actually doing some percussion, we could also ask the patient if they have any tenderness in any certain areas, so that way while we're inspecting that area to be very careful. Does that hurt right there?
No, sir.
No. So now what we can also be doing is we could also feel for the liver edge that's going to be on the right side. And the way we're going to do that is I'm going to place my hand on the patient's abdomen. I'm going to ask him to take a deep breath in. While he exhales, I will be pressing down firmly, and I will be feeling for the liver's edge, and then asking him to go ahead and take a nice deep breath in. And when his breath comes in, I will be grazing the edge of his liver. Okay, buddy? So what we're going to do is I'm going to put my hand here. You said you have no pain in anywhere in your abdomen, right?
Yes, sir.
You want to make sure you don't start too high, because then you could actually be laying on top of the liver instead of underneath it. So what I'm going to do is to make it a little faster. I'm going to do a little bit of percussion again so that I could get an estimation of the liver size. That way that I could start underneath it. Okay, so I'm estimating it's going to start in this area. So what I'm going to ask you to do, buddy, is you're going to take in a deep breath. Okay, when I tell you to, I want you to release it. You're going to feel me put a little bit of pressure. And once I tell you to go ahead and take a deep breath in for me, I want you to go ahead and tell me that you have to go ahead and take a deep breath, okay? So take a deep breath in for me. Now breathe out. Breathe out, 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 out. Okay, now breathe in. Okay, so I didn't really feel the liver, so I'm going to go a little lower. I may have been laying on top of it, and we're going to do this again. Okay, buddy, ready? Go ahead and take a deep breath. Release it. Breathe out, breathe out, breathe out, breathe out. Now take a deep breath in again. Good. That time I was able to feel it on the edge of my fingertips, and I was able to get it a little right below the coastal margins. So in order to fill the spleen, we're going to go ahead and do the same thing. I'm going to go ahead and I'm going to put my hand on the patient's left side. I'm going to go ahead and start again so that I could palpate for the liver. And we're going to be using the same process, okay? So when I say to, I'm going to ask you to take a deep breath. When you exhale, you're going to feel a little pressure, and then I want you to take another deep breath in for me, okay? So while he's breathing in, I'm going to be holding pressure on the left side. Okay, buddy? Go ahead and take a deep breath. Full, full, full. Now release it. I'm going to go ahead and put pressure. Now go ahead and take another deep breath. And I was able to palpate. It'd be a little hard to palpate unless you have a large spleen. Then at that point, you would really feel it in that area. What I'm also going to do, now that I felt for the spleen and I felt for the liver edge, I'm going to do a little bit of light palpation. So again, this is an opportunity for you to ask the patient, make sure that they don't have any abdomen tenderness. So you told me your stomach isn't hurting in any areas, right?
Yes, sir.
So what you're going to feel from me is I'm going to be feeling it a little. We're going to go light, and then I'm going to have to go a little bit deeper. Is that okay with you?
Yes, sir.
Okay, perfect. So I'm going to go ahead and I'm going to palpate using the tips of my fingers, and I'm going to go ahead and feel in the flats of my hands. Sorry about that. And I'm going to go ahead and just rub. And pretty much what I'm feeling for is I'm feeling for any abnormalities. I'm making sure that the patient doesn't have any areas of protrusion. I'm not feeling any masses of any sort. I'm gonna go under the umbilicus and I'm just gonna continue to palpate. Okay. So this was nice and soft palpation. So now what I'm gonna go ahead and do as well is I'm gonna go ahead and do some deep palpation. So what I'm gonna do is I'm gonna start right here in the little gastric area. And what I'm gonna do is I'm gonna completely relax my hand. I'm gonna just place it, and then with my left hand, I'm gonna go ahead and apply some pressure. Right now, what I'm doing is, since I'm right above in the gastric area, I'm gonna be feeling for the aorta, and I do feel it. And then we're just gonna continue to do some deep palpation. Does it hurt anywhere? Sometimes when you're doing a little bit of the deep palpation, you actually want to look at the patient's face, and you're also going to be checking to make sure that they're not grimacing or doing any guarding. When you're underneath the umbilicus and you're checking right above the pubic area, if the patient has a full bladder, you actually feel the full bladder. Do you need to use the restroom? Yeah. So I do feel his bladder. And when you get to the right part, the right lower quadrant, if you palpate hard enough, you can feel some of the stool. I don't feel stool, but I do feel some gastric bubbles moving. Do you feel a little gassy? Yeah, it's okay. Okay. And I do feel some gas in this area. There we go. And I'm just making sure that I don't feel no masses. Now, the spleen, it's going to be in trough space, but it's going to be felt a little more posteriorly. And where you have the costal margins, in these little areas where it's concave, you're going to have really back there, really posteriorly. That's where you're going to have your kidneys as well. So in this patient, I mean, like I said, it's nice, symmetric. I felt no masses. I was able to feel the aorta in the middle, right above the bifurcation. I was able to feel his bladder, and I did feel that the patient was a little bit on the gassy side. Okay, so I'm just going to take one more look, make sure the inspection is really nice, make sure we're okay. Okay, so one more thing that we're going to go ahead and do is I'm going to go ahead and I'm going to place the patient's shirt back down. I'm going to ask him to sit up for me. Okay, here we go. And while I have the patient sitting pretty much posteriorly, I'm going to make sure that the patient doesn't have any pain. This is the last thing I'm going to do. So we're going to hit over the areas where his kidney should be, and then I'm just going to give it a nice, I'm going to place my hand, and then I'm going to give it a nice little pound with my fist, okay? When I do this, buddy, I want you to let me know if you're having any pain. Okay? So go ahead and face straight, sit up for me. Okay, here we go. Did that hurt any? No? Okay. I'm going to do it one more time. So we just did the patient's right side. We're now going to do the left side. Go ahead and face straight for me, buddy. There we go. Any pain? Okay, we're going to do it again. Any pain? Perfect. We're going to do it one more time. Any pain? No? Perfect. So there were no abnormal findings on this patient. We were able to feel and see all the contours. There was no protrusions on the patient. The patient looks very well. Thank you for everything today. I appreciate you. Is there anything else I could help you with?
No, sir.
Okay. Thank you very much. You have a good day. Thank you.